welcome. It is the Dr. Nisha Jackson Show. I'm Rusty Humphreys. This is a part 2. This is a series on testosterone. But we're only having 2, right, Nisha? It's not like we're having 15 of these on testosterone.
We could have 15. I like to talk about men, and we could have 15 shows on this, but we're going to keep it to 2, and then we'll just touch on it with other shows, I guess.
Okay, if you missed the last show, you should go back and find it. You'll find it on iTunes or YouTube. And we talked about the symptoms of low testosterone, and right now I'm the poster boy. If you look like this, you might want to call Nisha and get that fixed, because that's the low testosterone. But now it's what you do to fix it. And the question is can it be fixed? I can attest that I had done some stuff with Nisha in the past. It's been a few years, so that's why this has happened. But I would say it was probably 5 or 6 years ago, maybe longer than that, Nisha. And I'm guessing things have changed. You've learned more about testosterone. So let's get into how we get it better.
Right. Well, first of all, we said this in the previous show about how testosterone affects the body, causes, when testosterone level is low in men. Again, it can happen at any age. We're seeing 30-year-olds, 40-year-olds, some 20-year-olds with low testosterone. It's very much connected to lifestyle and stress. But, the symptoms of low testosterone is fatigue, exhaustion, loss of memory and concentration. Men cannot focus very well when they have low testosterone. They're kind of like spacey in their head and a little bit ADD.
What are you talking about? What? What's for dinner tonight?
Exactly.
So I mean, I hate what's. Do you want to know what's ticking me off right now?
What's that?
Okay, give me what did you just say? It was tired, can't
Fatigue,
keep attention, exhaustion.
Yeah, see, I have to repeat it.
You're just ticking off my list right now, and it's like, I hate it when she's right. All the time.
Relationship problems, irritability, anger, outbursts.
Shut up.
Losing their vigor, problems with loss of creativity and drive and competition. Men have more body pain. They have more muscle cramps. They have issues with loss of sex drive and sexual functioning, or not being able to perform like they used to. I'm not talking about when they were 16. I'm talking about even maybe 5 years earlier. Also, men often notice when their testosterone levels are low that they just don't sleep very well. They can't get to sleep. They're waking up multiple times. They can't turn their brain off. They wake up in the morning. They feel exhausted. They're hitting the wall at the end of the afternoon. And so these are the symptoms that we went over on the last show. But what I want to talk about in this show is what happens to your body when you start optimizing testosterone levels, because it's not just testosterone. When you optimize testosterone, especially the way that we like to do it at Peak Medical Clinics, is provide the whole program. Okay. Optimize the nutrient levels, optimize the brain chemicals, optimize the thyroid, because thyroid and testosterone are very closely correlated. Mm-hmm. Optimize the diet. Reduce and help them understand how to manage their stress, get them to sleep at night so they can restore and make hormones when they're sleeping. So it's really the whole program. But what I want to talk about in this show, Rusty, is I want to talk about when you optimize testosterone, and that could be using alternative methods, or it could be actually using testosterone. So, and we can do both in our clinics, and most hormone experts out there can teach you how to do this. Okay. So these are some of the things that would happen with optimizing testosterone levels. Increasing blood flow to the brain. So all of a sudden you're thinking better, you're able to concentrate, you're able to focus. It's like turning on those receptors in the brain.
I've been noticing I forget words, or I'm right where I know. I know.
Yes.
No, it's right there. I get
exactly.
that a lot. Okay.
Exactly. The fatigue goes away. They start sleeping better at night. They're nicer to their spouses or their significant others. They're not flying off the handle. All of a sudden, they're wanting to go to the ocean on the weekend and take a trip with the people that they love. They're wanting to, get further in their job. Their competition, their edge for competition and wanting to be better comes back. They have less body pain, because we know that when testosterone levels are low, you have more body pain and more muscle cramping. They lose weight, they lose belly fat, they lose breast fat. Their breasts become less fat. And they're at a reduced. Now, this is one of the things that's difficult for men to understand, is because you can't feel it. You can't feel yourself at risk for diabetes, and you can't feel yourself at risk for heart disease, right? But you can see that you're gaining weight around your midsection,
Right.
and you can see that you're eating more than you should, and you're craving foods that you don't want to eat or that you shouldn't eat. So,
I mean, it almost sounds like everything you're talking about is it sounds like it's the fountain of youth for men almost.
well, it always was, right? Right? So, I mean, this is not rocket science. This is like it always was. So this is the fountain of youth. But we can't lose that. We cannot have men be losing their testosterone at 30 because of a high stress, poor lifestyle. We can't
Right.
we can't have that.
Okay.
Because what happens is that men become, I hate using this word in relationship to men, but I'm going to use it. They become feminized. We do not need men to become more feminized with their testosterone. Now, for whatever reason, I'm not talking about being a nice guy. I'm talking about being feminized, meaning that when you lose testosterone, you are losing some of those positive benefits that I just talked about that most men don't want to lose. And I really don't like seeing men spending half their life not feeling well and wondering why, like, why do I feel this way? And we also said in the last show that this often is difficult for men to really pinpoint, because they think, oh, it's just I'm stressed at my job and my wife is driving me crazy and I just got to quit drinking so much beer, or I just need to stop partying on the weekends, or I just need to eat better, or my dad did this at 40 also, and this is like normal. This is like part of my genes. That's garbage. It's not part of your genes. This is not the way you were meant to age. It's not normal.
Is one of the symptoms, and I don't mean to be, this is not a political comment in any way, but
okay.
Bill Clinton.
Good. Yes.
No, he used to talk like this, right? He talked like this, and now he kind of has a higher voice of it. Now that he's older, I don't know if you've noticed, and I'm wondering if that is low testosterone.
Yes. So it does affect your voice. That's why I have such a low voice, because I keep my testosterone levels really high.
That in your car drive. Oh, I have no doubt. I would not fight Nisha in any way, shape, or form. She'd beat me like a rented mule. But I mean, you also, you hear movies. Okay, woman, yap, and they're fighting at the old people fighting in movies and stuff. And a lot of times the men's older voices, they're higher. So I'm guessing that's a testosterone thing.
You know what that just made me think of? It made me think of Archie Bunker. Mm-hmm. You know the Archie Bunker show where his voice was like high. Yeah. It was hilarious. Anyway,
I tell you what, Edith. Yeah. Terrible impression, but yes.
And also Meathead. Do you remember Meathead on that show? His voice was high also.
I have no doubt that Rob Reiner has no testosterone whatsoever. That
okay,
aside,
anyway.
Yes.
Okay. So loss of lean mass. And so men notice when their testosterone level becomes optimized, all of a sudden they're able to build muscle again. Now again, I'm not talking about this being a vain thing. This is not just to look good and have a better sex drive. This is really to become healthier, because muscle mass, Rusty, increased muscle mass is more healthy than increased fat mass, right? It has 10 times more blood flow than fat mass.
Now, let me ask you that, because this is kind of the same subject, but kind of not. I know, athletes, and they get in trouble for taking testosterone or steroids, right? Now, I'm not suggesting it at all that they take too much, but I don't think it's wrong for them to take, as they get older, to take a testosterone, for example, to get the level where it's supposed to be. I don't think that should be illegal. You can't help that your body loses testosterone. Am I right? Or is that?
Oh, it just so infuriates me that are really, and I've seen a lot of these men, professional athletes, I've seen them in my office. I've seen them be trying to perform at a very high level, and it's killing them because they don't have enough hormone to do it. They don't.
And it's not their fault. They didn't do anything wrong.
And it's not their fault.
Right.
No, because just the very fact, so go back to the lifestyle, just the very fact of overtraining. So we see this a lot with cyclists. I see many cyclists in the office that are high performing cyclists, but they're over exercising, they're overperforming, and it stresses their adrenal glands, their stress glands.
And I would also think that little seat that they're on for hours and hours and hours at a time in that one core area is probably not good for them. Is that true?
Well, that's a whole nother subject, but yes, decreased circulation to the pelvic organs can have something to do with it. I don't know how you get me so off track.
Well, no, I would think that would decrease your testosterone. No,
that's not helping. But really, it's the over exercising, it's the overtraining, but it's part of what they do, right?
Right.
So even men that are excessively exercising because they're just trying to reverse the negative effects of testosterone is actually making it worse because they're stressing their adrenal glands, their stress glands out, and it's robbing testosterone even more. So this is all tied together, and I love doing these shows because I like to try to connect the dots for people so it makes sense. So back to so we talked about increased lean mass with optimal testosterone. We talked about loss of excessive body fat. It lowers your risk for diabetes and prostate cancer, which is one of those things that we've been brainwashed to think that testosterone causes prostate cancer. But now we have research to show that testosterone treatments may actually help prostate cancer. We also know that testosterone is optimal for reducing the risk of osteoporosis because it not only increases muscle mass, but it stabilizes and can increase bone mass. So these are just all of the things that get better when you optimize testosterone. So now I want to talk about how do you even do that and how do you test for low testosterone?
Hey, Nisha, how do you even do that and how do you test for testosterone?
Good question. Thanks for the lead in.
I'm glad I could help.
Way to hang in there with me, Rusty.
Yeah.
Okay. So it's a simple blood test, right? You just come into the office. When we see a patient in the office, a male patient in the office, we want to look at the whole profile. We want to look at all the hormones. We want to look at the sex hormones. We want to look at testosterone, estrogen, progesterone. We also want to look at the thyroid hormones, not just a TSH, but all the thyroid hormones, because those two endocrine glands are connected. So often we see low testosterone along with low thyroid. And then we also want to look at some of the adrenal glands, the stress gland hormones. So all three of those, it's kind of like a little triad, a little triangle of endocrine glands. And we want to look at all three because you might have a normal thyroid, but a very suboptimal testosterone, or vice versa. These three glands are connected and you cannot separate them. So we want to look at the whole picture. We want to ask about quality of sleep at night. What are the symptoms that you're having? What is your family history? What kind of things are happening in your life from a stress standpoint that are keeping you from living a more optimal, healthy lifestyle? What are you eating during the day? What are you eating late at night? Because again, all of these things need to be put together for a treatment program that will work for that particular person. And then we draw their blood.
And that doesn't take a long time. That's just a few questions you ask and you're getting through. I mean, it's not like this is a 3-week process to get started, right?
No, this is just the first visit. So
Right.
it's, it is a little bit longer visit, but it's the first visit to really get a picture of what is going on with this man.
What are you concerned about eating at night? Ice cream, that kind of stuff?
So again, one of the risk factors for stress on the body is overfeeding yourself. And Americans, well, the whole world is notorious for overfeeding. And overfeeding can be not necessarily too much food, but the wrong timing of food. Because if you start eating first thing in the morning and you're still eating within 20 minutes of going to bed, like even if you're just snacking, like we've been brainwashed to think that grazing all day long and well into the evening is super good for you. Well, it ain't. It ain't good for you.
Okay.
So because what you're doing is you're making your body digest all day long, all into the evening, and then you go to bed and your body's digesting. Every time you're digesting, you're taking away the energy from other areas of your body that you need for restoration, especially while you're sleeping.
You're a big believer in intermittent fasting, something we talked about a few shows ago.
Huge. It completely nails it for people as far as their weight control. It just nails it. So, and it's really good to do as you get older, to work on intermittent fasting, because it gives your body more hours for rest and digest, and recover, and that's really important for fat mobilization. Okay, so we do the blood test, and then we have the gentleman come back, and then we go over all of the test results. So here's the tricky thing in regard to testosterone. So a typical result, I was actually going to print a result out for y'all to show you, and maybe I'll do that in a minute. But the test results, if it shows low testosterone is, how do I put this? It's interpreted differently. Like if I lined up 10 medical practitioners or doctors, you're probably going to get 10 different definitions of low testosterone, which is really unfortunate for the patient, right? It's really unfortunate.
Because your definition of low testosterone and a family practitioner's definition is probably going to be different, because you're going to think a higher level of testosterone is more acceptable than he might. Is that correct?
Well, I think there's a different, yes, that's right. But not just a family practitioner. It would be a family practitioner, a primary care provider, whoever, that just doesn't know that much about hormones. You know, they don't learn a lot about this in med school or in practitioner school. They're just really not taught about hormone optimization and how hormones affect the whole body. It's not a huge part of the curriculum.
But it should, I mean, from hearing from you, it should be one of the biggest parts of the curriculum. I mean, you're telling me that hormones are affecting everything.
Yes, and it is a bit controversial, because there's mixed studies on the optimization of testosterone and how good is it for you. And again, if you research something for long enough, you're going to get some mixed reviews, right? Because this is the individuality of every person is a little bit of a moving target. It's hard to study certain things like depression. I mean, you know how hard it is to study depression and control variables? Yeah. Okay, I'm getting off here.
You're doing great. You're not getting off. You're doing fine.
Okay, so when we interpret the test results, here is the most conflicting thing for interpreting test results for testosterone. When you look at a total testosterone level, because there's two different testosterones we look at. One is called total, which measures all of the testosterone in the body. And one is called free testosterone, which is the available testosterone at the cellular site. Now, you don't have to remember that. It's just two different measurements of testosterone. But when you look at a total testosterone level for a man, the range, the normal range, and this is called a reference range, is 300 at the low end and 1,200 at the upper end.
That's a big difference.
Exactly. It's so broad. It's almost ambiguous. And so if a man walks into the office and he says, "Hey, Nish, I have memory loss. I have depression. I'm exhausted. I'm not sleeping at night. My body hurts. I can't remember anything. I'm flying off the handle. I'm irritable. I've been getting muscle cramps. I'm at the gym 4 days a week. I can't build any muscle. I'm getting so fat around my middle. My breasts are getting bigger, and I'm talking in a high pitch." And I get his test results back, and the level is 302. Mm-hmm. Now, remember, the reference range is 300 at the low end and 1,200 at the upper end. Right. So let's say I get his test results back, and it's 302. I could actually tell him he's normal. I could tell him, "Oh, you're in the normal reference range.
You're in the range.
Have a good life. It's normal." Now, that may sound a little harsh, but men are actually hearing that in the office, which is, I think, criminal. I mean, it's negligence. Because a man that has that many symptoms and has a level of 300 needs to be treated. They need to be treated with a whole program, not just given a shot of testosterone, the whole program. So there's a difference, Rusty, between a reference range and an optimal range. We want men, for whatever age they are, to be in the optimal range. So obviously, I would prefer a male to be over 500. Now, every man is different. Some men feel better at 700. Some men feel better at 1,000.
I mean, I want to be a manly man, so don't I want to be at 1,200, maybe 1,300, just to kind of make it so it's right. I'm a man.
Just give me that rad 2,000 level.
Right.
No. So every man is different.
Okay, why is that bad? There are negatives for going too high, right?
Yeah, I mean, that's not the goal. The goal is to optimize the man to relieve the symptoms and get them healthier, but not to go above the reference range. We want them to be in a safety reference range, but we don't want them to be at 300. It's just, a lot of men that come in that have all those symptoms I just mentioned are well below normal. They're at 200, they're at 100. We've seen men down to 25 or 30. So they're basically women at that point, because I'm not kidding. That's a low range for even a female. So
I mean, do you see guys like crying and things like that when they're that low?
Yes. Yeah, they cry at commercials. I'm not joking. They're very sensitive. They're overly sensitive, which makes them I'm going to just say makes them not able to manage stress very well. It's really sad. So, because men aren't wired that way, they're not wired to be like that. Right. And so, and it's very disturbing for them. But again, it's very difficult because it's an insidious onset to put their finger on this and say, this is unacceptable. So anyway, but also often by the time men get in to see us, they have been diagnosed with diabetes. They have high blood pressure. They have metabolic syndrome, which is that whole syndrome leading into diabetes and heart disease. They have problems with dementia. They actually do think they have Alzheimer's dementia because they can't remember anything. They're on ADD drugs because they can't focus. They're on drugs to sleep at night. They're on drugs for anxiety. They're on drugs for cholesterol because we know there's a correlation between low testosterone and inflammation, which leads to high cholesterol and high bad cholesterol, LDL. So they might be on 6 drugs that could have completely been prevented with optimizing testosterone and changing their lifestyle. Wow. So that's why I'm so passionate about this, because does this picture make any sense to you? I mean, seriously, this is very 101. It's 101. Okay. This is digging a little bit deeper and saying, you know what? This man has 10 symptoms of poor aging. This man has 10 symptoms or more of low testosterone. Let's dig a little bit deeper and figure out what's going on and get that dude back on track again. Get him on a healthy track, optimize his nutrients, optimize his brain chemicals, get his diet under control, and get him on a healthy path. Because why in the world would we want to give him 6 different drugs to treat symptoms?
Okay, so if I'm somebody with low testosterone, is it just diet, or are there some shots, creams, pills, injection, whatever? What kind of things do you do to help?
Yes, all of those things can be prescribed. So a man how we treat a 30-year-old or a 20-year-old and how we treat a 60-year-old there would probably be some variance in how we treat them, but everybody gets the whole package. We want to change the diet. We want to change the sleep patterns. We want to help them manage their stress better, like physically manage their stress better. The testosterone can be used in a shot form, which is usually a shot once a week or every 10 days, maybe sometimes every 14 days. Just again, it depends on how big the man is, because the larger the man is, the more efficiently they go through their testosterone. So you have to use a higher dose.
Does it last as long if you're a bigger guy?
That's right.
Okay.
Typically not. And that's another nuance in optimizing testosterone that a lot of medical providers are not up to speed on. I'm trying to be careful here. Anyway, and
why do you have to be careful? Is there an
I don't want to step on anyone's toes, anyway.
Okay.
So I'm trying to be respectful here. Okay. So testosterone.
Never heard you say that before. I guess we're getting close to something.
Maybe I need some testosterone. No, I don't actually. Okay. Testosterone injections, you can use testosterone cream that's compounded in a compounding pharmacy. There are FDA-approved testosterone patches and roll-ons.
Have things changed? I know, from 5 years ago, there was a kind of a cream that I'd rub on here and then a shot. Since then, I know they've done something with pellets, and this is the first I've heard of the patches. So what kind of how have things gotten better over the past 5 years?
There are testosterone pellets. They are bioidentical, meaning they're plant-based. They're prescription. And testosterone, USP testosterone actually is FDA approved. So they're testosterone pellets. They are pellets that are inserted in the upper buttocks area. So like in the right below the belt line, like below the waistline. There, some men have more fat there than others, but we put them in that area.
And now I have heard, and tell me if this is true, the shot is great, but the shot, you get a whole bunch of testosterone right now, as opposed to those pellets where they last for a couple of months. And so it kind of keeps it more even.
That's right.
Do you agree with that?
Yes. So the great thing about the testosterone pellets, besides the fact that they're non-synthetic, it's really pretty cool with the testosterone pellets. And again, they're not for everyone. They're really not for everyone.
Why?
Well, because not all men want to have something surgically implanted in their upper buttocks area every 6 to 7 months. I don't know why they wouldn't, but some men just don't want to do it.
Okay.
So, but testosterone pellets could be inserted, and they're dosed according to the man's profile. So they're very individually dosed, which I love. The levels go up typically within 72 hours. Their levels optimize into an optimal range, and then it lasts about 6 to 7 months. Some men a little bit longer. The weight has something to do with it. So some men who are very stressed or have a very high level of cardiac performance, they may run out closer to 6 months. And some men that are very sedentary and don't have a lot of stress, the pellets actually could last a little bit longer.
Like I have a friend who is a big guy, and they gave him a lot of pellets. I was surprised. I forget how many, but when he told me, it was like, whoa, I never heard of that.
Yeah,
but because he's a big guy, that kind of makes more sense now.
Yes, yeah. The body mass has a lot to do with the dosing of testosterone. So the pellets are a great option. We do a lot of pellet therapy. We watch our patients very closely. We test their levels on the pellets. We know exactly how long they last. We make sure that they do not exceed optimal ranges. So the testosterone pellets are great. When you put the pellets underneath the skin, your body actually develops capillaries around the pellets. So how the pellets work is that the hormone is actually carried via the circulation, those little capillaries. The hormone, the testosterone, is carried into those capillaries based on cardiac output. So here's the deal. Cardiac output is your heart rate, right? So when your heart rate goes up, you pull more of the testosterone off the pellet. When your heart rate goes down, you pull less. So when you're exercising, stressed out, moving around, having sex, whatever, whenever your heart rate goes up, you pull more of the testosterone off the pellet. That's when you need it.
Okay.
When you're resting, sleeping, taking it easy, and your heart rate's lower, you pull less. So the pellets actually they're not time release. They're based on cardiac output, which is really much more of a physiologic way of releasing testosterone for men and women.
Now, why can't I just take a pill for this? Can I take a pill?
There is testosterone pills, but we don't really like in our offices. And again, this is open to other people's opinions. This is the whole 10 doctors lighting up and getting 10 different opinions. I don't like testosterone making the first pass through the liver. It's not good for the liver to make the first pass. I would prefer not to have testosterone go to the liver. We call it a first pass absorption. It's not good to make a first pass absorption.
What do you think? I see commercials on TV. We'll make you a 300% testosterone. You'll be going off the ceiling in 10 minutes, and you'll be able to build 10 pounds of muscle in 14 seconds. Buy me now. I'm guessing that doesn't quite work that way.
Yeah, those are called secretagogues. So those are supplements that would be like in a performance category where they may be precursors to testosterone. A lot of them don't work at all. Some of them can optimize the levels to some degree. There are some supplements out there that do seem to work pretty good for men, not necessarily older men, but younger men, like pregnenolone is a supplement that we can use in younger men to optimize testosterone. So let's say we have a 25-year-old or a 35-year-old come in and they don't necessarily really want to start testosterone. They want to see what else can I do to bring my level up. Mm-hmm. This is what we would do. We would work to control their stress. We would revamp his diet. We would get him to sleep a minimum of 7 hours at night, because if you're not sleeping, you're not making human growth hormone. If you're not making human growth hormone, it's going to be very difficult for you to optimize your testosterone. we would definitely try to get more of his weight off of him, because increased body fat is a problem for testosterone. We would probably put him on pregnenolone, because pregnenolone can precurse, means that it can stimulate the production of testosterone. Pregnenolone is a hormone that's really high on the hormone manufacturing chain. It's one of the first ones right underneath cholesterol. So everything starts with cholesterol, right? All your hormones come from cholesterol. And right below that is pregnenolone, and testosterone. Most of your other hormones are below that. So using a supplement to precurse testosterone can work.
Okay. Let me ask you one more. We're running short of time. I know you got a ton to say, but another thing I heard was don't take any of that stuff, because your body will never make testosterone ever again for the rest of your life, and you're going to be hooked on that stuff.
That's not true. That's a myth, just like people that say that about thyroid, that is a myth. It's not true. It's a medical myth. And we know that's not true, because when we optimize testosterone, so just like you, Rusty, if you were to come back to me at some point and let me help you,
I'll be on the next plane.
If you would come back to me. No, this is not a sales job on you, Rusty. Trust me. If you would come back, your level most likely would be exactly where it was when I first started treating you. So you're probably going to go back to where you were when you started. It's not like you take this stuff and then you are 60 years old and you stop taking it and then everything's fine. It goes back to where you started. So it doesn't go to zero. It just goes back to where you started typically.
Okay.
So that's actually not true. And again, I don't know really how much that matters. If you have 10 symptoms of low testosterone and you choose a better lifestyle and you choose to optimize your testosterone, what do you really care about getting off of it?
Right.
Why would you want to go back to where you started? You felt terrible to begin with.
I think what their argument was, you need to go to the gym 3 times a day and work out 9 days a week for 10 hours a day and build that testosterone up like a man. I think. And by the way, and hire me as your personal trainer for all of that.
Yeah. I do think in some men that actually can work. I do think a man, especially a younger man with lower testosterone, I do think that there's some things that they can change to get their testosterone levels back up again. There's Clomid, there's HCG, there's other things that can be used to optimize testosterone levels. So it doesn't always have to be just testosterone. And I'm a firm believer in diet is 50% of your results. It's at least 50% of your results. So I'm not a believer in handing out drugs. I don't think it's a good idea. We don't do any service to our patients by doing that. So again, it's got to be the whole package. And men can feel amazing. Like men can get their life back and their partners will love them for it. They'll love themselves for it. It's worth it. Men are worth it. We need strong men in our society.
I agree with you. And okay. And so you do this in your clinic, and I would suggest people go to you. I know I've worked with her and she is fantastic. You've got clinics around the country. You've got them where?
Mostly in Oregon. We're moving into other states, slowly creeping out into other states. But mainly, I would love to just continue to train physicians and practitioners out there that really want to learn the whole treatment package to optimize people as they age. Because my goal in life is to help people age better with less age-related illnesses, because people are living longer, but they're not necessarily living healthier.
Right.
And if you're going to live longer, geez, why would you not want to be healthy and vibrant and active and have a great brain that's working for you? Why wouldn't you want that?
Absolutely.
I want that.
All right, so find out more about Nisha Jackson. Go to her website, nishajackson.com. You can also find her at peakmedicalclinic.com or at Peak Medical Clinic. She's got a great book out, too. It's called Brilliant Burnout, How Successful Driven Women Can Stay in the Game by Rewiring Their Bodies, Brains, and Hormones by Nisha Jackson, PhD. You can find that bookstores and Amazon all over the place. Don't forget to subscribe to the show. Let people know how awesome Nisha is. It's a great show, and people need to hear this information. So subscribe, forward the show, share it with your friends, and let everybody know about all the great information and how much fun the Nisha Jackson Show is. We'll see you next time. Thanks for checking us out here on the Nisha Jackson Show.